This is the Snowbiz Now Entertainment Network. Hello and welcome to Action Equals Life, the series, the companion program to actionequalslife.com. Our purpose, expressing the truth of our lives and transforming the planet. I just wanted to call your attention to protests that have taken place across the state of California today, which is June 10th, 2009. Most of the protests that took place at the Desert AIDS Project has been videotaped and is available for your viewing at actionequalslife.com. I'm Nicholas Snow, the founder of the website, a person living with HIV. I invite you to check it out. Thanks.
If we can handle 12 pills a day, AZT and everything else, from KS to neuropathy and everything else, from stigma to homophobia to racism, you better believe it, we can handle this. And so I ask you now, will we allow our leaders to deny life-saving AIDS medications to Californians? No! Will we allow our leaders to eliminate HIV testing and education programs? No! Will we allow our leaders to eliminate home care for people too sick to get out of bed today? No! Will we allow our leaders to stop counting the number of new infections so that nobody else in this country knows what they have done? No! Will we allow our leaders to turn back the clock on years of progress in fighting this AIDS epidemic? No! No, that's right, because the lives of our community is too valuable. We will not go quietly into the background. We will not go back to promises to those we have lost. We will not forget how we lost them while our government agencies were at their feet. People we loved died. We will not let this happen again. There are all kinds of poverty in the state of California, and not all of them are defined by federal regulations of what is and what is low income. There is poverty of voice, there is poverty of political muscle, and maybe the state has forgotten, but we are not that kind of poor. We will be heard. Yeah.
Hello everybody, my name's Dan Farias, and I've lived here in the desert for 6 years now, and I've been an AIDS activist for over 20 years, and it started in San Francisco with the mobilization against AIDS, and there was, of course, Project Inform, and of course we all know what ACT UP was. And it's really heartening to see you all here today. We know what happens when these funds are cut. We've been through this once before. When my partner died in '86, there were no drugs. He lasted for 7 months. We know what happens when these funds aren't available. When we don't have dental care, we have our teeth taken out because there's no medications and we get infections. When we don't have housing, people with AIDS live under bridges, along the creeks. We know what happens, and we are not going back to those days again. The governor thinks he can balance this budget on the backs of all of us. We are not going back to those days again. In this last week, as I was going along and passing out those letters and getting people to sign them, some of the people would go like this: "Oh no, everybody's going to get cut. There's nothing we can do about it." Well, I say that's wrong. We can't stop these cuts. We will stop these cuts. And it'll take activists like all of you coming to meetings like this and writing letters. We know how to do this. We've done this before. This building is a result of activism. The services we get in this building are a result of activism. And if all of you continue to be activists, we will stop these cuts, and the governor will be proven wrong again. Yeah.
Hi, my name is Michael Sauser, and I've been living in the desert here for about a year and a half. A long-time visitor to the desert, but I've been having home health care. I've been having home health care since about 1997 in Los Angeles and out here. I first started getting home health care when I had hip surgery. I had my hips replaced, both hips, due to vascular necrosis by HIV protease inhibitor. We didn't know that that was going to cause the disintegration of hips. We didn't know that these drugs were actually going to be killing us, just as they were going to be helping us. That was one of the most horrible things to go, realizing that I could not even walk around. I couldn't take care of myself. I was totally disabled, suddenly. I had AIDS dementia complex, totally without the ability to speak, or to reason, or to speak in coherent words. The home health care abilities that I had were totally nil. The home health care program brought to me the ability to live a halfway decent life in my own home. I wasn't relegated to going into the hospital, or being taken care of by people that I didn't even want to be dealing with. I had people that came into my home once a week, cooked, cleaned, helped to take care of my drugs, and through these years, over time, the home health care agency came into my home and took care of me. And just, it's amazing what they've been able to do for me. These funds are being cut. And this is the fastest growing segment of the HIV population. These numbers are not quantified. I talked to my social worker, and I talked to my home health care nurse, and they tell me that their caseload is increasing dramatically. They don't quantify these stats, but as people are living longer, they're not necessarily living better. These people need to be taken care of, and when we can be having a better life for people, they can perhaps get stable enough that one day they'll be better enough to go back to work. But when you deny people, home health care workers, they deteriorate, they degenerate, and they lose their ability to even have a ability to even one day go back to work at all. I don't know how to say it, but this is one thing that is in the backs of people's minds. They don't realize that this is a lifeline to the outside world for a lot of people. This may be the only person that comes into their home at all. They have nobody in their life except for the home health care worker. Anyway, I'll stop speaking now, but I really appreciate everything that everybody does.
My name is Carol Lee Soule, and I'm the Chief Executive Officer at Desert Regional Medical Center in Palm Springs. Okay, I'm going to start it again. Is this better? Okay. My name is Carol Lee Soule. I'm the Chief Executive Officer at Desert Regional Medical Center in Palm Springs. I'm also a governing board member. Thank you. I'm also a governing board member of the Desert AIDS Project, and I'm pleased and proud to be here. I've been in the Coachella Valley for just about 13 years. I think help is arriving. I've been in the Coachella Valley for 13 years. In those 13 years, 90 hospitals in California have permanently closed. And 41 emergency rooms. Desert AIDS Project is a model project for the nation. It's an absolutely critical and vital public health service in this valley. We are partners in healthcare, and any of us in healthcare need to be concerned about everyone in healthcare. And I'm talking about persons uninsured, and I'm talking about Medi-Cal. In California, there are 7.5 million persons uninsured. and California has a higher proportion of poor people than the national average. We must, for example, we must keep HIV testing free. If we limit HIV/AIDS medication, if we limit that medication, and we limit care, and we limit screening and prevention, that's extraordinarily short-sighted. There will be new infections. Thank you.
I'm City Councilmember Rick Hutchison. Thank you very much for being here today. You are the message today. I'd just like to make a few points about why our being here is so very important. First, none of us here today are naive. We all know that our state budget is in a terrible mess. Every city, every family, we are all making tough decisions and having to do with less. However, we elected those folks in Sacramento. When we did that, we gave them the responsibility to make tough choices, to assign priorities with care, and to make judgments about which values are the most important values to protect. And what can be a higher priority for our elected officials than protecting our very lives? Nothing is a higher priority. Funds. The AIDS Drugs Assistance Program are at risk. This program is the primary source of access to life-saving medications for more than 35,000 Californians. A second point, Palm Springs. Palm Springs is a place with special needs, a special place with special needs. We're an international tourist destination. Many thousands of people come here to vacation and enjoy themselves. And we are a city that is welcoming to everyone. As we know, not every place is welcoming. As a result, many in our gay and lesbian community have not only vacationed here, but retired here. In order to serve our community appropriately, it is critical. It is critically important that we have coordinated HIV education, prevention, and testing services. My last point, in Palm Springs and in Riverside County, Present AIDS Project is the provider of these critical services. Thanks to the supporters, the donors, the volunteers, DAP has been growing for more than 20 years, and we're all grateful for that support. But the need is growing too. Every month, DAP sees more people who need help. In the last year, more than 400 additional clients were added to those who are being provided services by DAP. The need is greater than ever before. So let's join together to send this important message to Sacramento. As you set priorities, as you make your budget choices, saving lives has got to be priority number one. Thank you.
I'm Michael Bell, and I am on the client committee here at the Desert AIDS Project. And the first thing that I would like for everyone here to do, if you would, please, think of someone that you know or knew who we no longer have with us. Bring them to your mind right now. We have just doubled our numbers. So thank you. Now, what really bothers me is the fact that the budget is going to be turned back. We're turning back time, but where are we going? Are we going back 26 years ago to when a small group of people got together and said, hey, look, something terrible is happening? Are we going to go back to a time when an actor was sitting in the executive office and denying our very existence? No! We cannot 26 years ago, people were gathering together in this desert to form an organization called the Desert AIDS Project. They started it. The tradition is theirs. It is up to us to continue that. We are not going to be victims. We are going to be victors. We will survive. We have to face the fact that tragedy is around the corner. We have made it to the top of the mountain, but we cannot look back in apathy. Many of us have come to Palm Springs to get away from activism, but we need you again. We cannot be walked over anymore. And I encourage any of you who are clients to please consider joining the client committee. We are the liaison between you and this building. And we want to work together to make our lives easier, happier, and healthier. So please join with us. Thank you.
Good afternoon. My name is Joe Acosta. I'm the community co-chair of the Inland Empire Planning Council. One of the folks that have to deal with the Ryan White funding. Before we go any further, I didn't speak in notes. I'm speaking from the heart. Louder, okay. How's that? Okay. I'm speaking from the heart, no notes. I want you to know, I want to thank, first of all, the Desert AIDS Project for providing this opportunity. I want to thank David Brinkman for being an advocate, along with Peter DiMartino, along with Richard C., along with Alex Christensen, along with Mark Cohen, Larry Gibson, and Mr. Dennis Way, and a few others for going out, taking the time, and also Doris Wall for doing a lot of work as far as advocacy is concerned. Unfortunately, that's not enough. We've been facing even more graver news as we get ready for our summit, which is scheduled for next month. We're going to decide how we're going to spend the money that the feds have given us for Ryan White to spend for Riverside and San Bernardino County. It's going to be tough because we're going to have to make up those cutbacks that California is imposing it. Now, we don't have to receive that kind of cut if you remove the name of away from your vocabulary. Come back and become an activist. Now, we've done a lot. Leadership has done a lot. Now, it's up to you. You need to get angry. You need to take no for an answer. Not accept no for an answer. That's fine. But you need to reach out to every single member of the state legislature here in our local area and take no, accept no is not an answer. Demand funding. Make it tough. The reason I'm sharing this way is that I had a comment I received from Dr. Soriano, who's on the state Office of AIDS Board. And he was at the first hearing in Sacramento. He says, I guess you folks are not that interested in the cuts, because all we heard is San Francisco AIDS Foundation and the LA Commission of AIDS. He doesn't realize we can't afford to go there. He doesn't realize there's a lot of us that have kicked off on local work here. So I'm asking you, I'm imploring you, reach out, show your anger, show your frustration, let them know that this is not an acceptable policy. Thank you.
I'm Marv Scholl. I'm here as a father, a grandfather, and a friend to many hundreds of you here in the valley. Just as many of you, I lost my youngest son to AIDS 18 years ago at the young age of 35. It was then when I met the people at the Desert AIDS Project on Vela Road, just a small office that had only existed for about 5 or 6 years. My wife and I became volunteers with one of the finest groups of people we have ever encountered in our lives. To work for DAP with the hope and the promise that this should never happen again to young people. And as I look out at this crowd, I see so many young people that are here today because of the work done by the Desert AIDS Project. That, my friends, is what the DAP has done in growth to become one of the most respected AIDS centers in this country. We don't want to lose that. No. I, as a parent and as a grandparent, I don't want to lose that either. No. So I'm here with the rest of you to show the solidarity.
Thank you.
This is now the time to make good these promises with more medical hope than ever, not to watch our children and our loved ones die and disappear again. We must let the state legislators know that the anticipated cuts and the amount of $80 million that they're concerned with would be the most devastating thing to our community that could ever happen. And of all the hard work and all the accomplishments that this Desert AIDS Project has done, we can't let it disappear. We can't let it. We must do everything in our power to prevent our government from letting this happen. Besides signing petitions, which I'm sure will come around, we must encourage everybody to contact their congressman and explain to their friends and their neighbors and family what is happening here. Thank you for allowing me to express myself. While we can, please, everybody, help as you can.
Hello, everyone. My name is Mark Cohen. I'm a long-term volunteer here, a client for 14 years, and I'm a proud member of Caballeros, the Gay Men's Chorus of Palm Springs. And we're here to tell you, to remind you that there comes a time when you just got to stand and help to change the tune. Thank you.
There comes a time when you just gotta rise. You've been down so long and can't remember why. There comes a time when you just gotta stand. You realize inside someone will give you a helping hand. You gotta stand up strong, stay on proud to be thee. I got my own sense of pride and my dignity. There comes a time, and the time is soon. We gotta find the piper and help to change the tune. There comes a time, and the time is now. You realize inside that you always knew how. You gotta stand, proud to be me. I got my own sense of pride and my dignity. There comes a time, and the time is soon. You gotta find the piper and help to change the tune. There comes a time, and the time is now. You realize inside that you always knew how. You gotta stand to be me. I've got my own sense of pride and my dignity.
Hello everyone, I'm Kurt Ringness, the President of the Board of the Desert AIDS Project. I've been on the board of this wonderful organization for 11 years, and the work that we do is just unbelievable for this community. But on behalf of all of our clients, our employees, our volunteers, and the board, I want you to know how much it means to us to have all of you show up here and show us your support in this problem that we're facing right now. And I would just like to say, as Marv said, we can't let the Desert AIDS Project go away. Marv, I'd like to say we won't let the Desert AIDS Project go away. Thank you very much.
Hi, my name is Terry Whitmer. I'm a client of DAP. I would like to share with you my first experience with DAP. I came in for an intake. I was practically homeless. I didn't realize that I was sick. I was so sick I didn't even realize it. About 20 minutes into the intake, my asthma was so bad that I couldn't breathe. They called the paramedics and they took me to the hospital. I was there for 2 weeks. During that time, DAP checked on me daily to make sure I was okay and let me know I wasn't alone. When I got out, they had got me housing, clothing, and food. And as my health got better, they helped me move. As my health got better, they helped me move into the Rick Wise apartments. That's where they got me get clothing, furniture, food vouchers, and the programs here in DAP. I would like to say to DAP, thank you for your kindness and treating me as family. I am forever, forever grateful. During the 80s, I watched my family, friends, and colleagues all die around me because we didn't have any medication to fight AIDS and HIV. Now, over 25 years later, the very drug medication program that's been keeping us alive all this time, ADAP, and other related HIV programs are being threatened. We must fight. We can't allow this to happen. We're strong. We must stay strong. We have to send out a message that we're overcome, not that we will lose. We must stand together. Stop the budget cuts. Please don't send us back into the 80s. Please don't send us into a spiraling conflict with death. This is a life and death situation. If you stop ADAP, the people with AIDS would almost surely die. The people with HIV would almost surely get AIDS. To me, that's like killing us. Please don't kill us. We want to live. We have a right to live. Over 35,000 people uses AIDS and HIV-related programs in California. Every 9.5 minutes, someone in the U.S. is infected with HIV. What are we going to do if we don't have HIV testing and counseling programs? What are we going to do if we don't have home care programs for the sick that can't get out? I must say, DAP has helped us. Now it's time to show DAP that we love DAP, because I love DAP. And if they take ADAP from us, we will die. Please don't kill us. Please don't kill us. And from when I last checked, killing is against the law. Thank you.
McBrayer, and I've had this disease now for 15 years or longer. I've lost a lot of people with it. We have to walk forward, not backward. I'm tired of seeing people go, and we've gotten used to living. So help us all. Let's keep this program going and get everybody involved, because it's a winner. Thank you, DAP.
We would like to sing a verse to you of Amazing Grace.
Join in.
Please join in.
Join us.
Amazing Grace, how sweet the sound that saved a wretch like me. Was lost, but now I'm found. Was blind, but now I see. Thank you, everybody. Thank you, everyone.
Good afternoon, everyone. Can you hear me? I can't hear you. I don't know about you, but I'm pissed off and I need to put my purse down for this. Because we ain't having it. No, we're not having it. Not in this community, not for our community. My name is Evelyn Valentino, and I am the Chief Executive Officer of Working Wonders. I'm here today to represent the women and the children who will be adversely affected by these proposed budget cuts. I only have a short time here, but you need to know this. I contracted HIV from my fiancé, who died soon after our wedding. I was a newlywed and a widow before I knew what hit me. That was 15 years ago.
All right.
Thank you. That's right. Today we are facing unprecedented budget cuts that will also adversely affect women and families in California. These mean-spirited budget cuts will most certainly result in less money for life-preserving medication and life-preserving education efforts that are already spread way too thin. If you knew what we hear, Working Wonders, what we hear from the kids in the school today, it would make you cringe. And we cannot have that. Because of the federal government's abstinence-only programs, today's teenagers don't know enough to protect themselves. Realistic people acknowledge that abstinence is only one way to prevent HIV transmission. But also accept that many kids don't choose that road. We must continue our efforts to educate California's youth about the risks and realities of HIV transmission. to eliminate or drastically reduce the funding for the State Office of AIDS would be disastrous to low-income families in many ways. Many of those families are here this afternoon, and we are here to provide, to protect, to advocate on their behalf. All of us here, and many of you come before us, have worked too hard for the life-sustaining support and life-sustaining education that is partially funded by the Office of AIDS. We cannot, we must not accept these cuts when the threat to all of the people of California is as serious as ever. Infection rates are still too high to drop our guard for a moment. Our youth especially depends on us to ensure that they are informed about the risks and realities of HIV and AIDS. And we cannot and must not let them down. What happened to the governor's proposed No Child Left Behind? What about our children? No child left behind. In my eyes, what I've been seeing is that every child in our community has been left behind because of the cuts that we are experiencing in our schools. Approximately 120 teachers will soon be receiving their pink slips. Programs in the schools will be cut. Who will be responsible for educating our children about HIV and the risks involved with HIV infection? That job is our job, the community. We need to come together. We need to come together as a family, regardless of race, ethnicity, socioeconomics. Regardless, we are here as one. We are united, and I'd like to thank David Brinkman for giving me this opportunity to speak on behalf of all women, children, and families throughout the entire state of California. Hell no, we won't let this happen. Thank you.
Hi, my name is Ken Owens. I'm a client of HIV, client of DAP, and an HIV survivor for over 25 years. I'm part of the HIV support group. I've been on the planning council for the Inland Empire, or I am on there, and I've also been on the client committee. This is very important to me. I don't think a lot of people realize that any cuts to the budget at the state level will result in cuts to matching funds from the federal level. That's very, very important. We need to keep all the funds we've got. The Title I requirement is that we match the funds that we spent the prior year by at least $1 more. If we cut education and prevention, we're not adding to ADAP, so we're not going to meet it. We're going to lose all the federal funding for ADAP. It's just so important. I want people to really realize it. And I'm a child of the 80s and 90s when all this was happening, and I lost so many friends that I just can't begin to count them. And I see a lot of friends out here that have also moved down from San Francisco because of that loss. We can't let this happen, and we won't let it happen. I ask you to just get behind it and write and do whatever you can. Thank you.
The sad thing is that we have to assemble for such a reason. My name is Mark Anton. I'm the president of the AIDS Assistance Program. And thank you. My partner in crime here, Chris Campbell, and I, we see 500 plus people every month that are on limited income and have no money for any extras whatsoever. Every day our phone rings for people asking to be put on our program, and right now we have a waiting list of approximately 50 people. So I have one thing here. I want to ask a show of hands, or I have a question. In a lot of countries, people think that the death penalty is cruel and unusual punishment. How many of you here agree with that statement? These cuts, in my opinion, are cruel and unusual punishment and cannot happen. We need to make sure whatever we can do to stop this, it's nonsense. There are so many other ways that we can cut rather than cutting people's lives. Thank you.
My name is Rick Vila, and I am a volunteer, a client, and also a donor of the Desert AIDS Project, where I've been for 7 years. I'm here to appeal to the consciousness and the heart of our legislators. I want to ask our legislators to just for a moment walk in our shoes. I have been positive since the 80s. I've seen people die and struggle with this disease since the very early days. In fact, I moved into the Castro on the very first day that AIDS was announced in the New York Times. I've seen how the life-saving medications have saved us and have kept us productive members of the community. I am asking our legislators to take a look at these numbers. 79% cuts for prevention and education. 54% cuts for home and community HIV care. 76% cuts proposed for testing. I ask our legislators for just a moment to take an average of those percentages and take that money from their paychecks and see how it feels. I ask our elected leaders to please take a moment and stop. There are other areas where funds can be cut. I agree there's government wasteful programs that can be cut, but don't cut it from people who depend on these programs for their very existence. On the day that I was diagnosed, I was stressed out and tearful, and a friend took me into his rose garden and said, why don't we go tend the garden together and just relax? And as I was clipping the roses, I scratched myself from the rose bush, and I had 3 or 4 lines of blood on my arm, and I felt like I was diseased and dirty, and like I didn't want to see anybody. Right now, I see all of this red in the audience, and I am reminded of that day, and I don't want to see more blood. Legislators in California and in Sacramento, if you are going to put red in our numbers, you will have blood in your hands. Yes. Community here at Desert AIDS Project and other HIV care communities in this valley, that I do the work that I do with love, and I would like to approach this with a combination of anger and love, because that's ultimately the love is the connection that we need to make back, so that these folks who are making these decisions understand that the decisions they make affect real human lives. Thank you.
This is the Snowbiz Now Entertainment Network.